Hi, I'm Cindy Veldhuis, and I am going to talk about mental health during the COVID-19 pandemic. I'm a postdoctoral fellow in nursing, and I'm a research psychologist. So first, I want to talk a little bit about some of the previous research on mental health and previous epidemics, pandemics, and quarantines. A meta-analysis that was done recently in January looked at the effects of quarantine during previous pandemics, and it suggests that there are both acute and long-term mental health impacts. Some people experience mental health impacts even 6 to 9 months out. And some of the early findings from China indicate the serious mental health impact of COVID-19. In one recent survey with over 50,000 respondents that were surveyed between January and February 2020, almost 35% of the sample experienced psychological distress. And they also found that there were significant regional differences in psychological distress, with respondents from Hubei province, which is the epicenter of the COVID-19 pandemic, reporting significantly higher distress than other areas. So why would we expect that there would be mental health effects? The social isolation, financial hardship, and fear associated with COVID-19 may present a perfect storm for a public mental health crisis. And also, social distancing recommendations may increase the likelihood of mental health symptoms, since isolation is known to have detrimental mental health effects. There are also concerns that substance use will increase, and that the economic effects may have severe impacts on mental health. Difficulty with finances not only contributes to stress, but it's also one of the leading barriers to receiving mental health and substance use disorder treatment. We're also seeing increases in relationship strain, intimate partner violence, and other source of support stress. And finally, there are disproportionate effects of the pandemic on people of color, as well as increases in racist and discriminatory acts. And then also people with pre-existing mental disorders may be more heavily affected by the increased stress due to the pandemic, which could lead to relapse or exacerbation of psychiatric conditions. So I'm going to share some data from the current pandemic, and this data comes from part of a task group out of Johns Hopkins, and we formed on March 13th of 2020 in order to try to make sure that existing panel studies, so that is longitudinal studies primarily that are going on across the world, included questions about mental health. We really wanted to make sure that we were tracking the changes in mental health over time related to the pandemic. So we've been working with Pew to make sure that they have mental health questions. I'm going to talk a little bit about Understanding America study data, which is out of University of Southern California, with Facebook to make sure that they include mental health questions in their survey. And then we have additional partners as well. So in the Understanding America study, which is a representative study, so it represents the entire United States, what we found was that this was early in the pandemic, so this was March 10th until March 16th, that there was a linear increase in distress over time. So we asked people how distressed they feel on a scale of like 0 to 5. And over that 1 week, there was a linear increase in distress. And we found that distress was highest in the areas with the highest proportion of outbreaks, which is similar to the data that's come out of China. And in a separate paper, we looked at almost the entire month of March and found again a linear increase in distress over the month. So there's definitely some distress going on here. So one of the things that I wanted to do with the study that I'm going to present today is to use not just single items, which is what we had to do when we were working with studies in order to increase the number of mental health questions or to include mental health questions at all. I wanted to use empirically validated, psychometrically sound surveys in order to look at mental health. So some of the research questions that I'm going to answer today are: how is the pandemic affecting mental health overall? What are some of the key correlates of depression in particular? And then what are the changes in mental health over time? So the study that I'm going to talk about today started on April 5th. It's a convenience sample, so most people in the study were recruited through social media, through our social media. I also got some help from Columbia to get people through the Research Match program. It's an international sample, so people in the study represent every United States, all 50 states, and then over 45 countries in the world. The study was open to anyone 18 or over who could do a survey in English. There were no other inclusion or exclusion criteria, so it was open to almost all adults. And it's a longitudinal study, so we are surveying people every 2 weeks for the first 3 months, starting in April, and then we'll also follow up with them once a month for 6 months. And we may extend that depending on what happens in the future. The sample for the study that I'm going to talk about today, I'm mostly presenting baseline data, so this is mostly data from that first week of the study, which is the week of April 5th. And the sample for that is 2,948. So first I'm going to talk a little bit about some of the COVID-related concerns of the people in the study. So this is of 0 to 100%, how worried are you about COVID-19? And what you can see is that there's a little bit of a ceiling effect here, or maybe not a little bit. There's a ceiling effect. So people are primarily pretty worried about COVID-19. Interestingly, when we look at how worried they are about their own health, there's a normal distribution almost, or showing that people are less worried about their own health than they are worried about the virus as a whole. But interestingly, people are more worried about their family health than they are worried about their own health. And this is a little bit surprising because of what I'm going to show you here. So 20% of people in the study definitely or probably haven't been exposed to COVID-19. And this was again in April. So we're following this longitudinally and we'll be able to look at changes over time. 30% of the baseline sample reported at least one COVID-related symptom, which is given that they're more concerned about their family's health than their own. So they're maybe more worried about whether or not they might have coronavirus and how that could affect their family members. And almost 20% of respondents reported knowing someone who had died of COVID-19. Again, that was in early April, and so we're tracking that over time. We asked about the employment effects. 6% of people lost a job, 12% lost a job opportunity, like a job offer had been taken away, withdrawn. 17% had their work hours reduced, 7% had been furloughed from their job, 2% had to take on an extra job, and 7% had to go on unemployment. And 17% of people were no longer getting paid, and 1% of the sample said that they were not sure whether or not they were getting paid anymore, which I'm sure is really anxiety-provoking for them. We asked questions about food insecurity. 15% of people often or sometimes worry about running out of food. 19% of people worry about being able to feed their children the way that they feel like they should. We asked questions about relationships. So 35% of people in the sample can only sometimes or rarely get the support that they need. And 44% of people in the sample reported that they feel lonely. We asked if people feel safe at home, and 18% of the sample reported they have at least some safety concerns at home. In terms of mental health outcomes, all of these things like increased risks for distress, and indeed more than half of the sample it has probable depression as measured by the CESD. 25% of those with probable depression have no history of depression, so this is a new experience for them potentially, although some of them may have felt depressive symptoms previously but never gotten treatment for it. Of younger people, we're more likely to be depressed. There are no differences between men and women. There are no differences by race, ethnicity. People who are sexual and gender minorities are more likely to be depressed than are people who identify as heterosexual. And 7% of the sample was at some or high risk of suicide. And among people with a history of depression, they had more than double the risk of suicide ideation behaviors than people with no history of depression. 68% of people feel like they feel helpless. 50% report that they have no control of their life, and 66% feel like there's nothing they can do to change things. And all of these three things are things that really predict mental health concerns. So this is something we want over time, whether or not people start to feel like they have a little bit of control and hopefulness about their future or not. We also looked at health behaviors. So we asked people about how has your alcohol changed in the past 7 days, and 36% of the sample said that they're drinking more than usual for them in the past week. 8% are smoking more marijuana than is usual for them. And 33% are eating less healthily than is usual for them. We also looked at differences by probable depression, so whether or not they likely have a diagnosis of depression. And first, I'm going to talk about their fears. So people who have a probable diagnosis of depression are more likely to worry about becoming infected in the next 3 months. They're worried about whether or not they're going to be able to afford healthcare if they were to get infected. They're worried about mortgage or other necessary expenses. and they're worried about running out of food. They're also drinking more than are people with not depression, and their drinking is more likely to have increased, and they're also more likely to have increased their use of marijuana. The last set of findings I'm going to show you are from the changes over time, and this is just one set of findings. So one of the things that I really wanted to look at with this, because there's been reporting that related to previous pandemics and related to previous quarantines, that people have PTSD, so post-traumatic stress disorder, after pandemics and quarantine, which is really interesting. So I wanted to look at acute stress or post-traumatic stress type symptoms during the course of the pandemic. And that's called peritraumatic stress. And all of the measures on peritraumatic stress are asking about retrospective reports. So at this point in time, how did you feel 2 weeks ago, 3 months ago? Did you feel like you had, were hypervigilant at the time? From what I could tell, there were no peritraumatic trauma at the, sorry, I'm a little bit nervous. There were no measures of peritraumatic stress that you could use at the time of the traumatic event. So I took the impact of event scale, which is a measure of acute stress and post-traumatic stress disorder, and modified it to look at whether or not people were feeling acute stress symptoms at the time. So these first numbers aren't going to make a lot of sense because it's just an absence of knowing what the change is from time 1 to time 2. But I'll give you a little bit of an overview. So the bottom one is acute stress. So this is the stress overall. This is all of the items summed up, and this is the level of acute stress that they feel. And then there are 3 subscales that we look at for post-traumatic stress or acute stress. Intrusion, so how much feelings, worries, images of the traumatic event may be intruding on their life, whether or not they feel hyper aroused, and whether or not they're avoiding anything related to the trauma in order to sort of protect themselves emotionally. And what we found is that almost all of those doubled. So in terms of acute stress, over a 2-week period, there was almost a doubling of acute stress symptoms, which is really concerning. I'm not showing it here, but we also see an increase in depressive symptoms, although it's not quite this of this magnitude. So bringing it all together, longitudinal work during the pandemic is really important in order to be able to track changes over time. Previous research suggests that the mental health effects of such disasters may be long-lasting. So we need to understand who's highest risk, both in order to understand the acute effects and also who's going to be most at risk over the long term. Our findings suggest that people who are worried about money, who are worried about food and the virus, are also more likely to be depressed. And further, those who are depressed are more likely to have increased their substance use. There's some limitations to the study that I think are important to note. So although it's a fairly large sample, it's a convenient sample. I often describe it as being an extremely convenient sample. We used our social media networks in order to get this sample with some other ways of getting data. And so the sample is far less diverse than I would like. It's not representative of this population by any means, much less the world. There are fewer men and there are fewer people of color in this study. And given the disproportionate effects of both COVID and economic effects of the pandemic on communities of color, improved representation is really important. It's also going to be important to examine whether or not there are disproportionate impacts on mental health among communities of color. We've translated the survey into Mandarin, and we have been collecting data in China. We have over 500 data points from China to understand the longer term impacts of the pandemic on people, so that's a nice way to do that. And we're currently translating into Spanish. We're almost ready to go live with that, so that's going to help us increase
in your 2 minutes warning.
Thank you. So one of the things that's going to be important is that we're going to need to make sure that there's mental health supports long after the pandemic ends. Our findings suggest that there are groups that are most at risk, even though this is mostly descriptive data. We need to increase access to mental health care and to destigmatize the need for care. Previous research on the long-term effects of pandemics and quarantining suggests that the end of the crisis does not necessarily bring an end to the mental health effects, and those affected may experience PTSD, depression, anxiety months or even years afterwards. So any interventions that are created in response to the pandemic must include longer-term follow-up, and they must be accessible to those who have lost health insurance as a result of the pandemic potentially, and those who have few economic resources to pay for treatment. So it takes a village to do a study. I have really great collaborators across the US from Columbia, Penn State, University of Illinois at Chicago, the Williams Institute, which is in California, Yale University, Harvard, and UC Berkeley. I am open to any questions, and there's my contact information. Thank you.
Great, thank you.
With 3 seconds to spare.
Fantastic. Let's see if there are any questions. I don't see anyone. Yeah, okay. We have Maria Palasuto.
So I wanted to ask you, you said that you use social media. Exactly which were the social media that you used and why you choose that?
Yeah, this was not a funded study, so we had to just use our networks. I used Twitter and my Facebook account and just tried very hard to get people to share it with their own networks. We got a really nice boost when collaborators Liz Nessoff got the Columbia Epidemiology Department to boost our recruitment materials, and the March for Science picked it up, and we got, I think, over 1,000 people just from that. So yeah, if it were a funded study, I think we would be using methods that would give us a much more representative sample, but we wanted to quickly get some data.
Thank you very much.
Yeah.
Question from Eric.
Hi, Cindy. Thank you for the talk. The question I have is, are you also trying to track what people are doing to help themselves cope with the stress, other than the increased drinking and drug use? And are there strategies that you're able to identify that they're doing that may be particularly successful?
Yeah, so the survey is probably, it can take people between 20 to 40 minutes to take. So this is just a very small portion of the questions that we ask. In the baseline survey, we ask them how they're spending their time, because that's really interesting to us. In this next wave, which will be the third wave of data, we're going to ask, like, what are some of the positive things that have come out of the pandemic for you? What are some of the ways that you're coping that's been helpful to you? We ask about coping. I didn't present that data, but we look at how people are coping and whether or not that's associated with higher levels of distress.
Thank you.
And Cindy, I have a question whether there's any studies or any sort of insight on whether the type of traumatic stress that comes from these type of events can be recuperated rapidly, or whether it is instead long lasting. So, you know, when the pandemic is going to be over, do you feel that people will have long lasting effects from these, or there will be a rapid recovery?
So as a psychologist, sometimes I say things and I realize that to the general public that this may sound a little bit callous, but one of the fascinating things about this pandemic is that it's really unique, which is a little bit exciting from a data collection point of view, but maybe not so much for people who are experiencing distress. So previous pandemics have tended to be, unless we talk about the Spanish flu, which we don't have data from, have tended to be a much smaller scale. And so people are primarily dealing with that in more isolation. So one of the things that's unique about this pandemic is that it's experienced by a lot of different people across the world. And we don't really know what the long-term effects of that are going to be, and what the acute stress, post-traumatic stress effects of that will be. Like, is there something healing about the fact that you're not going through this alone, that there are all these people around you? Is there something maybe more traumatic about the fact that people's experiences of the pandemic are so different depending on where you live and what your political affiliation is, for example? So we just don't know. The other thing is that quarantining in past pandemics has been very different at times than it is for this one. So I often imagine, like, quarantining for Ebola, that was a very different experience for people, that they were most likely highly isolated, as happened more in China than here, and were forced to quarantine by the CDC or other health organizations. And that's not the same here. So there are a lot of things that are very different about this that I think are going to be really interesting to follow. We just don't know whether or not PTSD is going to be easy to resolve, and that's likely going to change based on whether or not you have a history of trauma. So if we have someone who lived through Hurricane Katrina and is now going through the pandemic in our study, so the effects on that person are going to be very different from someone who's never had any kind of trauma, especially no kind of like natural disaster. So we'll have to see who's most affected and how quickly it resolves.